And good afternoon. It is time for our regular Lunch and Learn. And I am going to be talking to you about some how to cure common diseases. And these are not my words because, of course, I'm not medical, so I can't use those words. But this is from a report that I'm going to be talking to you about. And the title of the piece is Curing Common Diseases Without Drugs or Surgery. Now, most people don't know that you can do that the way we are conditioned in the United States. And if you watch any kind of commercial television at all, you're told all the time through the commercials that this drug, ask your doctor about this drug, ask your doctor about that drug, all that kind of stuff. Why? Because they're trying to sell medication. So what I want you to know from this paper, and it is from a research scientist, her name is Martha Rosenberg, and she does a lot of exposés on medical and medical research, and so she's really, really good. She lectures at colleges all around the United States. She's been on television and that kind of thing. She's very, very reputable, and so this is what the statistics say. And you know how we're always being told to follow the science. I believe in following the science, but I believe in following credible, repeatable science. Okay, so that's what we're doing. So as I said, most people hear all the advertisements on television and radio, and they think that they need to go out and get this prescription or this surgery or this whatever. And so, as we've said before, there is a condition called EPI, endocrine something, 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 okay, insufficiency. There is no such disease. However, they have made a drug to treat that disease. And so on the television, and I have seen this, and I do not watch much television myself, but on the television, I have seen this in the past 4 months. You may have EPI if you have these conditions. You need to go talk to your doctor and see if this medication is right for you. And so because we're bombarded with that all the time, we believe that we are a sophisticated country. We believe that we have all the modern medical marvels, and we do. And this is not bashing the medical system. I'm thankful for the medical system. If I have a heart attack or I'm in a car crash or anything like that, I definitely want to get to my local medical center. Because why? Because that's what they're really, really good at. They're not really, really good at chronic diseases. And so that's what we're talking about today. Now, yesterday, I don't know if you know this, but yesterday, the CDC, FDA came out and they say we are no longer going to be giving you this hypertension medication because we have found that it causes cancer, so they've taken it off the market. Now, we looked at that medication. That medication's been on the market for a long time. It is FDA approved, but hocus pocus, as of yesterday, it is no longer approved. And so we want you to know that if you're doing medication, you may need medication. I'm not here to tell you not to do medication. I'm here to show you some research that shows that if you do these lifestyle changes, it can be as effective as medication, right? And so that's what we're going to be talking about today. So obesity, poor food choices, smoking, alcohol consumption, and lack of exercise contribute to everything from cardiovascular disease, clogged arteries, diabetes, chronic pain, and depression, right? So that is our lifestyle choices. Insurance helps with surgery, insurance helps with medication, but it will not give you the support that you need if you want to hire a nutritionist or a personal trainer. Now, this article is going to go on to say that if you do hire a nutritionist or a personal trainer, you're going to be way, way ahead of everybody else who's doing the surgery and the medical interventions, okay? So let's talk about heart conditions, since I just talked about blood pressure medication being recalled by the FDA. Heart disease is the leading cause of death in the United States, even though 90% of hypertension is preventable through lifestyle choices, and this is from those wonderful doctors at the Cleveland Clinic. All right, coronary bypass operations, which began in 1968, and stents, the use of which have become very, very popular since the 1980s, they're even considered a rite of passage for those people who are at risk of heart attack. However, the researcher says in 2020, There was published research in the New England Journal of Medicine found that neither procedure is better at reducing the risk for heart attack and death in stable ischemic heart disease than lifestyle changes along with medication. So not just medication, lifestyle changes. Now, what causes your blood pressure to be high and causes you to have coronary heart disease? Well, obesity is the number one thing. Sugar diabetes as well. Both of those are preventable by the food that you choose. Remember, the statistics are 1 in 3 of us is obese. 2 in 3 of us is overweight. You just have to look around anytime you're in public to see the amount of people that are overweight in our country. Now, I'm not trying to say this to fat shame anybody or do anything except we can prevent this as we change our behavior. We want to be able to do that. So they found in this study that lifestyle changes and medication is just as effective as bypass or stents. Now, that does not mean to say if you go to the doctor tomorrow and he finds an 80% blockage that I don't want you to do a stent. Of course, do a stent. Learn from that, moving forward, change your diet, change your habits, and then you won't have to do that again. But thank God we've got that if we need it. But we shouldn't want to depend on that, okay? The doctors say that lifestyle treatments include patient counseling about diet and exercise and medication for blood pressure. These taken together, the quality of life and clinical results suggest that there is no need for invasive procedures in patients without symptoms. This is from Dr. David Maron, who was the study's leading author. He says that the research shows that we can strengthen and begin treating with medication and lifestyle changes, and then if the symptoms persist, then we can go to more invasive treatments. And I think that's an excellent plan. I don't want anybody dying of a heart attack, and if your blood pressure is too high, take your medication. We want you to take your medication. But as you make lifestyle changes, you change your diet, you change what you're eating, you're going to lose the weight, your blood pressure is going to come down naturally, and you're not going to need those medications after a certain amount of time. And so the problem with us here in the United States is that our doctors tell us, oh, well, you can eat what you like and you don't have to exercise as long as you take these medications. Well, when we do that, we are not changing what got us sick in the first place. So this disease is going to lead to another disease, which leads to another disease. Take obesity, for example. If you are obese, you're twice as likely to come down with type 2 diabetes. If you come down with type 2 diabetes, you're 4 times more likely to come down with a cancer. So one thing leads to another, leads to another, leads to another. So just taking a medication is not what you need to do, okay? So Joel Kahn, who is a cardiologist, said that the study should lead to major reduction in the number of bypass surgery and stent surgeries performed, adding that the results confirm that lifestyle medicine works. Yes, we want to do that. Now, let's move on to diabetes, as I just referenced that a moment ago. 37 million Americans have diabetes, according to the Center for Disease Control. 1 in 10. That's 1 in 10. So think about 10 friends that you know, 9 friends that you know, because you're one of them. One of you have diabetes. That's a horrible statistic, all right? Yet, diabetes is 90% avoidable with adequate lifestyle changes, according to research published in the Archives of Internal Medicine in 2009. Yes, there are new diabetes drugs. Wall Street loves them. They're selling very, very well. However, they appear to be risky. Now, I'm going to try to say these drugs correctly, so give me some grace if I don't get it. Okay, there's a drug called Steglatro. Okay, I don't know if anybody's taken that. This drug for diabetes increases your risk of lower leg amputation, especially if you have had prior amputation, a foot ulcer, heart disease, circulation problems, or nerve damage. Now, we know that diabetics have circulation problems. That's just across the board. We know that. We know that when they get wounds, their wounds do not heal. We know that, okay? So this particular drug, which is one of the new drugs, it's going to increase your chances of having a lower limb amputated if you don't do some lifestyle changes. So that's really, staggering to me. Thankfully, in my family and my immediate family, nobody has diabetes, nobody's pre-diabetic. We're all good in that. Most of my family, right, eats well and they have healthy lifestyles. I'm just going to leave that out there. There's another medication called the zombie. Now, I would not want to have a medication that had zombie in its name. I mean, I'm just saying, they don't spell it that way, but that's the way you pronounce it, right? I don't want to be a zombie. I don't want you to be a zombie. But this particular drug has been linked to heart failure, gangrene, diabetic ketoacidosis, pancreatic inflammation, right? We don't want to have that. So if you're taking that medication, these are new medications. No one's come to see me with these medications, but these are new ones. If you're taking those, this is what you're going to look forward to in your future. 90% 90% of diabetes, this is type 2 diabetes, is avoidable with lifestyle and diet changes. Type 1 diabetes is a different animal altogether. So if you have type 1 diabetes, this does not apply to you. But if you have type 2, which is what most of the people have, then this applies to you. The I'm not going to say this one right. Sulfonylureas, right? I probably didn't say that. This is the oldest class of diabetic drugs, are now linked to heart attacks and heart issues, says the National Center for Health Research. All right, a 2009 study found that getting enough exercise, eating a healthy diet, not smoking, drinking very little alcohol, and maintaining healthy body weight could prevent diabetes, and doing the opposite could lead to diabetes. 9 of 10 new cases of diabetes appear to be attributable to these 5 lifestyle factors. So, how preventable is diabetes? Very, very preventable, but you have to do the work. You have to make the changes, and changes are hard, right? It's a mindset. I'm a very rigid person as far as I like my routine. I feel safe in my routine. I don't want to change my routine. I'm owning that, all right? If it was a choice between eating what I like to eat and knowing that I'm going to have diabetes, guess what? I'm going to change that. In fact, when I learned all this stuff about holistic health after my husband died, remember, my husband died because he was over-radiated. We went the medical route. They over-radiated him. He died of radiation poisoning. Don't think there was any malice involved. Not saying that. It spurred me to look at what could we have done differently. When I learned all the things that I learned that I needed to quit drinking sodas. I learned that I need to quit eating pork. I learned that I needed to quit eating packaged foods. I learned all that stuff. And so because I want to be healthy, because I do not want to be on prescription medicine, because I do not want to be fat, because I do not want to have diabetes or hypertension, I made those changes. Now, do I miss bacon? Of course I miss bacon, right? I'm not going to eat it because my health is more important to me than indulging in something that I want. All right, so was that hard? No, it really wasn't hard. I had to make a decision. I made a quality decision for my health, and I'm just telling you, I am on zero prescription medications, and my blood work is perfect. So I want you to say that too, and you can say that if you just make these lifestyle changes. So if you have diabetes, when you exercise, your muscles use glucose for energy. Regular physical activity also helps your body use insulin more effectively. Now, a lot of times, overweight and diabetes, you are told that you are insulin resistant. Well, that's because you're not moving your body. If you move your body, then you can reverse that insulin resistance using the glucose the way you need to, and it will reduce your overall sugar numbers. Now, we have people that come in here who are diabetic, who are on medication, but they know when they check their blood sugar, if their blood sugar is too high, they'll get on their stationary bike, they'll get on their treadmill, they'll do an hour's worth of exercise, and guess what? Boom, their blood sugar comes down into normal range. Now, right now, obviously, they don't have enough self-control or self-discipline or whatever you want to say to be able to do that consistently enough not to be on medication. Thank God we've got medication, so they're still here with us. So I'm not bashing them. I'm not, none of that kind of stuff. However, you can maintain and regain your health in most cases. There are some cases that said 1 in 5, right? If you were the 1 in 5, you could not be helped with lifestyle and diet, but all the rest could be lifestyle changes. You could get there. Okay, so let's talk about 2 other classes of drugs, all right, that everybody wants to take, because guess what? I can eat what I want to eat, and I don't have to make the hard choices. So one of those is statins. Almost everybody who's over 50 is on a statin, and the other one is protein pump inhibitors. So if you have over acid, your doctor gives you, I don't want to call out brand names because I don't want to get in trouble, but you know who you are, right? So these 2 classes of drugs, they give you a false sense of security, all right? So cholesterol-lowering statins, such as Lipitor, this is in the article, so I can say that, the most successful drug class in pharmaceutical history, promises people that they can ignore diet and exercise concerns and the body would forgive them their bacon cheeseburger. Well, according to the Mayo Clinic, statins can lower cholesterol in people with high cholesterol, reducing their chances of having a stroke or a heart attack. However, the drugs are not risk-free and can interfere with the body's necessary supply of cholesterol. These drugs can cause muscle pain, liver damage, type 2 diabetes, increased blood sugar, and cognitive problems such as memory loss and confusions, side effects which were underreported during statins' heyday. Now, you may or may not know that there was a study, the Framingham study, and that study was never able to be replicated. And that is a study that all the doctors hung their hats on, that we needed to reduce the cholesterol numbers. Now, your cholesterol used to be back in the day, if it was 200, 220, 240, you were good. Now, medical doctors are telling me that they want your cholesterol close to 100. Now, let me explain to you or remind you, sometimes I feel like I'm, riding a horse here. Cholesterol, every cell in your body needs cholesterol. Why is that? Because your cell wall, your cell membrane is made up of cholesterol. Your brain is 80% cholesterol. Every hormone that your body makes, your adrenal hormones, your thyroid hormones, your pituitary hormones, your pancreatic hormones, your testicular and ovarian hormones, all of those hormones are cleaved from the 28 atom molecule that we call cholesterol. So if your doctor is wanting your numbers to be down, close to 100, you're not going to have enough cholesterol to go around. That's why you get the brain fog. That's why you get the muscle aches and pains. And that's why all of these other diseases are going to be there, because your body does not have enough cholesterol to go around. You have 3 types of cholesterol. One is your triglycerides. That's pretty much what you're eating. That number being high is going to futuristically say that you're going to have heart issues, all right? Your LDL cholesterol is your marker that shows that you've got a lot of inflammatory response in your body. Now, we like your body to have an inflammatory response. Why? Because your body sees something that's not right, it mounts an attack, we have inflammation, all our soldiers go to work. We may make some LDL cholesterol because that is nature's Band-Aid. We don't want to get on a statin to lower the cholesterol. We want to find out what is the cause of the inflammation, remove that cause of inflammation, and then the body will just presto changeo quit making the bad cholesterol so that you don't have that problem anymore. Now, your liver is where all of these hormones are cleaved, and you're going to have liver issues if your cholesterol is high, if your hormones are not doing what they need to be doing. So liver dysfunction is pretty common. Why is that? Well, that's because we eat garbage food, and our liver is our main filter. So what we want to do is make sure our liver is doing what it needs to do so it can produce the right amount of cholesterol. If our LDL is too high, then we're going to do some lifestyle changes. We're going to do some diet changes. We're going to do some anti-inflammatories that are natural. Get that trigger down, and then your body's going to go, oh, they fixed it. I don't need to make high cholesterol anymore. I don't need to make high LDL anymore. Your HDL is your so-called good cholesterol, and if that is too low, then that is a liver dysfunction as well. So we don't want that. We want your cholesterol to be in range, but this is why it is not in range. So I hope that's helpful to you moving forward, that you can do what you need to do. Okay, we do not want liver damage and all that kind of stuff. So researchers writing in the Drug Safety Case Reports in 2016 noted correlations between statin use and violent ideation, irritability, depression, and even suicide. The problems resolved when statins were discontinued, but then reoccurred when the drugs were started up again. This strengthened the hypothesis that mood problems were linked to statin drugs. All right, so if you're on a statin, then you're having emotional issues, you're having depression, you're having anger outbursts, and that kind of thing. You might want to check and see if there's something that you can do a little bit better. The next class of drugs that we're going to be reviewing is the protein pump inhibitors. This is what your doctor is going to give you if you complain of acid reflux. What you may or may not know, all right, as you get older, over 50, okay, you can develop a condition called hypochlorhydria. Say that 3 times fast. Your body, your stomach, stops making hydrochloric acid. It does not make hydrochloric acid in sufficient amount to digest your food. That's why when you get older, you can't process proteins very well. You can't process certain foods that you used to have no problem with because you've developed hypochlorhydria. So there are supplements that you can take that will give you that hydrochloric acid that you need in your stomach to digest your foods. What you may or may not know, over acid and under acid, you're going to have the same symptoms. Most people have under acidity. They've got the acid reflux because they're not digesting their food. When you put them on a protein pump inhibitor, it further depresses the acid, and so it makes the situation worse. Okay? The research says PPIs, protein pump inhibitors, are overprescribed and overused according to medical sources and can have significant side effects, especially after long-term use. Do you know you're not supposed to use a protein pump inhibitor for 14 to 30 days? After that, you're supposed to discontinue. How many of you, raise your hand, how many of you have been on protein pump inhibitors for years? All right, a lot of people. I know a lot of people. Oh, but I have to have it. Well, I know, but it's not the best thing for you. All right. So after long-term use, the side effects can be intestinal, such as nausea, diarrhea, mood-related anxiety, or muscular rigors and jerks and that kind of thing. All right. Long-term use of PPIs can interfere with mineral absorption and could cause bone fractures. Why is that? You need calcium in your bones to avoid osteoporosis. So if you are a man and you are on protein pump inhibitors, then you can look forward to bone fractures in your future. This is a warning that the FDA has added to the side effects of the PPI drugs, okay? These medications can also put users at risk of an intestinal condition called C. diff. Now, When you have C. diff, all of your good bacteria is gone and you just have negative bacteria in your gut. You've got chronic diarrhea, think dysentery, right? You get an ashen gray color. You lose a lot of weight because everything that goes in goes right out. There's no absorption of any nutrition, and it is really a killer. All right, so we don't want any. I have dealt with C. diff with people in my family. I have dealt with C. diff with people coming in to see me here. And so I know it can be resolved, but I know it can also be very, very deadly. When you're on antibiotics for a long, long time, then you can develop C. diff as well. All right. It can also lead to fungal overgrowth, cardiovascular problems, and pneumonia. All right. From a lifestyle change, PPIs, like statins, forgive unhealthy eating by removing the unpleasant consequences. However, once a patient takes a PPI for longer than a few weeks, acid hypersecretion can occur on discontinuance. This causes rebound symptoms and frequently establishes a vicious cycle of drug reinitiation and long-term continuation. Now, we don't want you to feel bad. We don't want you suffering acid reflux. We don't. But there are healthy things that you can do to change the environment in your gut. If you look at our Tuesday testimonials, we almost every single time are talking about the gut-brain reaction. The food that we eat, the lifestyle that we live causes dysbiosis in the gut. That means we don't have the right flora, we don't have the right good bugs in there, so the bad bugs take over and the bad bugs can kill us. I was going to finish up by talking about chronic pain, because so many people have chronic pain and they think that opioids are the answer. They think that spinal fusion, nerve ablation. I know a lot of people that do this. There is nothing that makes me want to have a procedure that's going to kill my nerves. Why is that? Because my nerves tell my body when it's in trouble. I don't want to discontinue that. Now, I do know that I do not suffer 100% nerve pain all the time. I get that. And so I understand that I'm not talking from a place of been there, done that, on that. However, there are herbs and supplements that will totally rebuild the myelin sheath so your nerves are not overarching and causing that burning sensation that you're feeling. Okay, I'm just saying that. The article goes on to say that let me get to it because I have to get a little bit quicker here. There is a paradox. It says chronic pain patients fear and resist exercise, but exercise would usually improve their pain through strengthening their muscles, reducing their mental stress, and releasing endorphins. This doctor urges patients to consider and explore the possibility that relief can be found by learning to relate to their pain rather than avoiding it. Now, honestly, I'm going to avoid pain, and you are too. I understand that. If you are in chronic pain, and I have been in chronic pain, I'm in very little pain, almost no pain right now. Those of you that know me know that I'm rebuilding a hip joint, and it takes a long time, but things are getting better, and I'm excited about that. And while I have had long months of chronic pain, 10 out of 10, today I'm virtually just a little uncomfortable and on 1 to 0 on the pain scale. So thank God for that. I know that if you take the right supplements, the right anti-inflammatory, the right nerve, the right, whatever's right for you, that you can overcome this. And the statistics that I just shared with you also confirm that. So I'm not going to go into any more of those statistics because it is time to end this broadcast. We are into the weekend, and I want you to do some self-care. I want you to love on yourself. I want you to think about what I've said. Think about your health. Think about the lifestyle changes that you could make. If you need an anti-inflammatory diet recommendation, we've got one. If you need anti-inflammatories, we have them. If you need, my help, we're here. We're here for you. We do these broadcasts to give you the tools that you need so that you can live your best life, because that's what it's all about. So it is the weekend. I want you guys to enjoy, and I will see you next weekend, next Friday at noon. Thanks for sharing. Thanks for commenting, and I will talk to you soon.